Okay, I think we're live. So sorry for the delay. I'm new at going live through Zoom, everybody. So I just want to welcome the amazing Dr. Edison de Mello, who is the director and founder of the Akasha Center for Integrative Medicine. Thank you so much, Doctor, for taking some time out today. Just want to let you say hello to everybody who's watching live.
Hello, everyone. I hope you're staying calm and safe in this physical distancing that is being required.
And explain why you call it physical distancing versus the other term.
Yeah, I know. Although I think that the term social distancing really brings home the message, we humans are social beings. And so I think what a better term would be physical distancing, because we can still be social with our friends on the phone or in social medias, in Facebook Lives, saying hello to our neighbors from across the hallway or across the, across the yard. So physical distancing, I think, encompasses what we want, we physicians, we scientists, what we want to portray to our population, what is needed at this point, but also encouraging people at the same time to share with their friends, to connect, to write, to find ways where they can be social without the physical presence that is required to fight this pandemic.
Absolutely. Absolutely. Well, we're going to dive right in here. I know that there are a lot of questions. There's a lot of information being thrown around. There's a lot of fear. And so I just want to let everyone know who we have here on this Facebook Live, because you are incredible. And I want to do you justice by actually reading your bio, just because, or it's a tiny snippet of it, truly. But just so if anyone's new to you, Doctor, you are the founder and chief medical officer, like I said before, of the Akasha Integrative Medical Center in Santa Monica, California. We are streaming live from California. You're in, I think, Santa Monica. I'm in Orange County. So we are bringing this to you live from California right now on the 23rd day of March. And you are a board certified integrative physician by the American Board of Integrative Medicine and a licensed psychotherapist by the California Board of Behavioral Sciences. You have practiced psychotherapy also for 13 years before entering medical training, and now practices and teaches evidence-based integrative medicine. And let me just say something really special about the Akasha Integrative Medical Center. I am a patient of Akasha as well as my whole family. And you also treat celebrities and all amazing souls at this center. It is a healing sanctuary where all parts that compose a person, namely mind, body, and spirit, are equally addressed when treating and preventing disease. The Akasha Center exemplifies Dr. de Mello's vision and strong commitment to the practice of integrative medicine. The goal is to help every patient get the best out of integrative and science-proven approaches to medicine, drawing from both the technological advances of the West and the ancient wisdom of the East. And actually, Doctor, you requested this time together. We have a partnership, Dr. de Mello and myself. So let me just quickly introduce who I am, why am I on this interview, and being the hostess of our time together, and what can I also bring to the table. So if you are new to meeting me, my name is Jennifer Joy Jiménez, and I am a health and well-being expert. I'm a speaker, teacher, and coach. I am the founder of the Health and Wellbeing Division of the Brave Thinking Institute. Brave being like brave heart, B-R-A-V-E, Brave Thinking Institute, which is the premier institute for transformational coaching, that being like life coaching, spiritual life coaching. And so we have a partnership with Dr. de Mello. Dr. de Mello provides the medical side of the health and well-being coaching that I offer. And then I can bring to the table really mindset tools and tips, as well as how to deal with some of the emotional side of being healthy and creating our best life. Our mission is to help people create and live a life they love living. And we believe in people. And we know that each one of us is far more powerful, and we contain so much more potential than any circumstance, any situation, any condition, including a virus that is sweeping our world, no matter what is going on, that there is a power breathing each and every one of us and an intelligence beyond our own intellect. And so, Doctor, you asked that I interview you today. Can you tell our viewers why and what you would love to share today?
Yeah, thank you, Jennifer, for making this interview possible. And there are several reasons why I suggested that we had this interview today. First and foremost is because I think there's a lot of rumors, of theories going out there. We are all scared, we are concerned, so we certainly tend to listen to a lot of information that is just not true. And this information is actually hurting the whole approach to fighting this virus. And so when I read this, and being that I am in my heart a scientist as well as somebody who really believes in the integrative approach and the body's innate way of taking care of itself, of fighting viruses, of enhancing our immune system, I thought, let's get online with Jennifer Jiménez, who is this incredible interviewer, this incredible woman with a vision, and let's go out there and talk to our population, to our base, and try to help them understand what's happening from a scientific standpoint, so that we can put the confusion, put the rumors to rest, and really stay focused on what we need to do as a country, as the world, to be able to survive this and to learn from what's happening. I believe that this is a wake-up call to all of us, not only in the US, but all over the world. We have finally, or we are finally realizing that we cannot operate with strict boundaries in terms of knowledge and us against them against us.
Yeah.
That this is a global phenomenon that is happening right now, and we are together in this. There's no us versus them. So I thought, let's spend a few minutes here today or tonight, whatever you are, explaining to you what I have learned from my research, from my contact with several health departments about this virus, and what is it that we need to do as a community, like I said, as a country, as a world, to stay afloat.
Nice. Beautiful. I'm so grateful for you in my life. You have made a tremendous difference in my life personally. I just want to start off. One of the questions that I know people have, and I have had clients texting me saying, as a health and well-being coach, I've been inundated with questions like, how do I deal with this stress? And how do I know if I have, the coronavirus? A client just today texted me saying, I have a cough and I'm starting to, experience symptoms. And people are looking for support. They're looking to have the proper information, myself included. You might hear my voice, and if you're new to me, my voice isn't typically this scratchy or deep. I get jokes sometimes when I'm a little under the weather that I sound like Demi Moore. So if this reaches Demi Moore, you have a very, gorgeous, lovely, deep voice. But I'm experiencing symptoms. I feel like I'm over the hump of that. And I even shared with Dr. Mello, I said, I don't know if I want to go live while I'm symptomatic. And he said, we need you to go live while you're symptomatic, because we want to talk about what happens. So let me just really briefly share that I was in New York. I returned home from New York. I flew to New York for a conference where I taught. I flew home on the 11th. I started to feel a little bit under the weather that next Friday. So let's say like the 13th, 14th. I did start to have a dry cough. I still have a dry cough. I never did have a fever, but I've definitely felt funky. I've definitely felt some body aches, some just lower energy. And I lost my voice for 2 full days, which was a little bit not scary, but just kind of like, interesting. I can't even talk. So I was, texting and typing and finding new ways to communicate. And Dr. DeMello was right there by my side and, sharing information, but there was quite a bit of back and forth. you know, and I also have, so Dr. DeMello is my integrative family medical doctor, but I also have regular medical insurance. So I reached out to Kaiser. I wanted to make sure that they knew that I was experiencing symptoms so they could track all of this as well. And they would not allow me to take a test. They are reserving the tests for the most ill, which is totally understandable. One thing that I will share that I have done that I am continuing to do was even before I started to feel symptomatic, I self-isolated. I had a birthday during that time. March 16th was my birthday. And so I had some birthday things that I had pre-scheduled before all of this was surfacing. And I canceled everything. I just said, I don't feel comfortable, even though I feel fine, I feel healthy, I feel good, just in case I'm a carrier. I really just feel like I should self-isolate. I chose this, as challenging it is as it is, with my amazing, gorgeous husband. I've been married for almost 25 years. No kissing, no hugging, no touching. We like do footsies under the bed. It's so cute. I'm like, oh, I miss snuggling with you. So we snuggle with our toes. But, you know, like, it's really important to be precautious and cautious during these times. So one of the questions that I know you really wanted to debunk was, what's the difference between the symptoms of COVID-19 and just the regular flu? And how can people begin to try to decipher or differentiate these symptoms?
I am so happy you're asking that question, because this is one of the things that it's being discussed at the highest level and minimized at the highest level, unfortunately. Those are two very different viruses. The symptoms may sound very familiar, and they are very familiar in some ways, but the coronavirus is a subset of the cold virus, the common cold viruses. So when we say corona and COVID-19, the difference is that corona embraces or encompasses all viruses that leads to the common cold, whereas COVID-15, a subset of the virus, causes the disease that's spreading all over the world. So one difference is that the rate of transmission, whereas a common cold, if you are a carrier or if you're sick, you're probably going to infect 1 to 1.5 to 2 people at most. The coronaviruses, the COVID-19, has doubled that infectation, that amount of people that will be infected by you. So and we're saying now 3 to 4. So imagine if you have the virus and you pass to 4 people, those 4 people pass it along to 4 more people, and the 4 people pass along to 4 more people. It's very clear, if you do the math, that soon enough, you will have transmitted this virus to thousands and thousands of people. Wow. And so what is the difference? The difference is several. For one, is how long it lasts in your body, the rate at which it infects people, the severity of the cases, and the rate of transmission that it keeps to be exponentially, keeps increasing. So the common cold viruses, you do the same. If you get a cold, you stay home, you do what's called supportive care, you keep your body warm, you drink a lot of fluid, you do your soups, your warm soups, you make sure that you keep yourself well hydrated, and you take medication when your fever is above 101, 101.5. In the COVID-19 situation, you do the same thing, except that the cough in the COVID-19 is usually a dry cough. Mm-hmm. And so we need to make sure that we know, is it a dry cough or is it a productive cough? A productive cough, means that you are producing phlegm. Yeah. Right? And so you stay a little congested. Right. Why is that important? Because COVID-19 transmits better through mucus. So when you have mucus in your nose, mucus in your throat, then we know that is one way that the virus uses to be able to keep replicating itself. Mm-hmm. And so it's important that you define, is this a dry cough, or is it a wet cough, the way we refer to it? The other thing is temperature. Now,
so pause you there. So for people that are experiencing symptoms, if it's a wet, mucousy cough, chances are it's just the common cold.
Yes.
The dry cough, chances are higher, not, like I'll never know exactly what I have right now because I'm not going to be tested. But what I am noticing is it is a dry cough, which means potentially, not for sure, but it could be COVID-19 in terms of just helping them differentiate.
Yeah.
And I also don't have a runny nose.
Oh,
So the
good.
other piece of it that I remember you sharing with me was, do I have any kind of, am I stuffed up? Do I have a runny nose? That
Exactly.
kind of a congested feeling. I don't have that. It's really just mostly in my chest. So I'm just helping them kind of self-identify as we go along.
Exactly. No, thank you for clarifying that. And remember, even if it's a dry cough, it doesn't mean that you have COVID-19.
Right.
It's more likely that we need to investigate than if you had a wet cough.
Right.
So that's one thing that we are always asking people to self-evaluate at home. Is the cough dry? The other one is fever. Now, there's been a little confusion out there. Everybody who has a temperature a little above 97.8 or 98.2 is calling us and saying, I have a fever. Or
Yeah.
when it gets to 100, I have a fever. No, you don't. The definition of a fever is anything above 100.4.
Mm-hmm.
Not 104, but 100.4. So
Right.
until then, if your body is increasing the temperature, it's doing that for a reason. The immune system has ways, very beautiful ways, to fight infections coming our way. One of them is through fever. And
Yeah.
so we don't want to be, we don't want to see fever as the enemy. Fever is there to give us an indication that things have moved a little bit to the higher infectious side versus, oh, it's just the body raising temperature to fight what's going on.
Yeah.
So what do I do? What do you do if you have a fever? First and foremost, don't despair. Stay calm, right? That's the most important thing that you can do is stay calm, because when you are nervous and panicky, your body releases cortisol. We all have heard about cortisol. It's the stress hormone. Cortisol reigns on everybody's parades, and cortisol also reigns on the immune system parade. So whereas the immune system is doing everything it can to keep you going, there comes cortisol, the stress hormone, and kind of sits on it, and in a way makes its job a little bit more difficult. So if you're a little anxious, and Jennifer can talk a little bit about this at the end, since this is
Mm-hmm.
such a great expertise of her, look for help. Look for somebody who can help you. Do something to get the anxiety out of your body. So that's the first thing that I recommend that people do when they're self-monitoring at home. And then let's find out if the temperature gets to a point where you need to take an anti-fever medication. And that is when it gets above 101 for adults. If it
Mm-hmm.
gets above 101, that is the time for you to contact your doctor, your healthcare practitioner, and say, my fever is about 101, 102. What do I do? There are many things that we know about this virus, scientifically speaking. One of the things that we know about it is that you should not take any of the common non-steroid fever medication. By non-steroid, I mean your Motrin, your ibuprofen. They're all the same medication under different brands. Ibuprofen is the classic name, it's the general name. Under that, you have Aleve, you have Advil. All of those have proven to be not good for the COVID-19 because it enhances duplication, replication of the virus.
Let's just pause there. Paying attention, everybody, because we're giving a lot of information. If you're experiencing a fever, and again, many of us, probably the majority of us that have symptoms, thank goodness I've not experienced any fever. There are people who've tested positive for COVID-19 who have not had a fever. I think the Hanks, who are still in Australia, have had symptoms. They did test positive. They never got a fever from what I've seen, although, who knows what the truth is, but at least what I've been reading through, multimedia. But my point just being that, doctor, thank you so much, because my default. If I got a fever tonight, knock on wood, hopefully that won't happen. My favorite go-to would be like an Advil. I would take Advil immediately. So it's really important for me to know, do not take, ibuprofen or whatever version of that I might have in my medicine cabinet, because it's been proven, what I'm hearing you say, it's been proven to make things worse. So what would I take? Is there something I would take?
Yes, at this point, Tylenol.
Okay.
The, yeah, the very important thing to take at this point is Tylenol without overdoing it. Tylenol at 3,000 milligrams and above during the day or in a 24-hour period can be toxic to your liver,
Okay.
especially if you have liver conditions such as, hepatitis. Some of us are carriers, or you've had, God forbid, liver cancer, or you have fatty liver. So don't take it, Tylenol, without your doctor or a healthcare practitioner monitoring you to advise you when enough is enough. So that's one thing that I think people have to really understand. And the reason why the ibuprofen and its derivatives are not recommended is because not only science has shown that it helps in the proliferation of the virus, but also Motrin in high dosages can really be upsetting to your stomach, and in some cases can really lead to bleeding if you have an upset stomach, or if you have some kind of gastrointestinal pre-existing disorder. Ibuprofen and its derivatives are not recommended. The
Now,
reason for that is because
is Excedrin an ibuprofen, or is that an acetaminophen?
now acetaminophen. Now I cannot say it. Just say Tylenol. No, yes, Excedrin it is. Excedrin it is, and it's called a non-steroidal anti-inflammatory drugs. And so those drugs can cause, in some cases, can even cause tiny amount of bleeding in your gut. What we know about this virus is that it also has an effect in your gut. And so we need to protect the gut from your gastrointestinal system from whatever it is that we are ingesting, that we are drinking, that we're taking, to keep your microbiome, your gastrointestinal system operating at its optimal capacity.
So just to clarify, no Excedrin either.
No Excedrin either.
Tylenol for now, everybody. Okay.
Just Tylenol. In
Got it.
some cases, aspirin. Aspirin can also be. Aspirin is not a non-steroidal medication. Doesn't fall in that category, Jennifer. But again, be careful that aspirin in high doses can also cause GI bleeding, and so we need to make sure that we are being careful.